Hi, my name is Hiwet and I am a pharmacist with extensive exposure to various products around the world. I'm talking about being around to over 50 countries and trying different products, not just the brands that have made it across oceans. It wasn't easy finally identifying products that work for us, people of color. If you're interested in the science of products and want to make the most out of your money, make sure you subscribe. I'm doing this vitamin series to give you the basic information about the vitamins in cosmeceuticals. The Food and Drug Administration, FDA, does not have a definition for cosmeceutical, and therefore it's neither recognized nor regulated by FDA legislation. I would hate to assume everyone knows what cosmeceutical mean by convention, so a little bit of background won't hurt nobody. A dermatologist called Albert Kligman introduced the term cosmeceutical in 1984 to describe products that do more than coloring the skin and less than a therapeutic drug. Today, the conventional definition of cosmeceuticals is an intermediate between cosmetics and pharmaceuticals. A cosmetic is an article intended to be rubbed, poured, sprinkled, sprayed on, introduced to the skin, or otherwise applied to the human body for cleansing, beautifying, promoting attractiveness, or altering the appearance, excluding soap. In contrast, a drug is an article recognized by a designated pharmaceutical organization such as the US Pharmacopoeia that's intended to be used in the diagnosis, cure, mitigation, treatment, or prevention of disease and intended to affect the structure or any function of the body. So the vitamins I'm discussing here fall within this category of ingredients. Your AHAs, BHAs, peptides, and vitamins are all cosmeceuticals. Now that that's crystal clear, I'll be talking about the most commonly used vitamin B ingredients in skincare today. Although there are various types of B vitamins or provitamins, niacinamide and panthenol are the ones you find most often in skincare. We'll see why and when you might want to reach for them. Let's start with niacinamide. Topical niacinamide is water-soluble and quickly absorbed. It's known for reducing fine lines and wrinkles, reducing hyperpigmentation and transepidermal water loss, strengthening the stratum corneum, soothing irritated skin with its anti-inflammatory effects, skin and hair moisturization, reducing pore size, and last but certainly not least, for preventing photoimmunosuppression and photocarcinogenesis. If you're wondering what that means, watch this video I have made that will give you some background on the damage of UV to the skin and eventually overall health. But how does it exactly do all of these? Well, the body is too complicated and oftentimes involves a cascade of events before reaching to the results we often simplify. But I'll try and give you succinct mechanism of actions to satisfy your curiosity. So first, as far as anti-hyperpigmentation roles are concerned, it turns out niacinamide reversibly blocks the transfer of melanosomes from melanocytes into keratinocytes by inhibiting keratinocyte factors. This mechanism is distinct for niacinamide because other hyperpigmentation ingredients such as kojic acid work by inhibiting tyrosinase directly. I was particularly happy to find studies with Asian subjects. As you know, people of color cover the majority of people on this planet, but most study subjects are focused on Caucasians. So I'm always interested to see studies that involve Blacks, Arabs, Asians, Latinos, Pacific Islanders, and just about anyone who's not Caucasian. So that way there is representation for us. So according to this randomized and double-blind study that had Asian participants, 5% niacinamide was used twice daily for 8 weeks to show significant reduction in hyperpigmented spots. Secondly, niacinamide improves skin barrier through involvement in the biosynthesis of lipids, free fatty acids, cholesterol, and ceramides. As you can imagine, this reduces water loss from the skin. As good cascade of events would have it, the skin therefore becomes more resistant to irritation or blotchiness. Third, vitamin B3 is a precursor to a family of endogenous enzyme cofactors such as nicotinamide adenine dinucleotide NAD. It's powerful phosphorylated derivative NADP and their reduced form NADH and NADPH, which have antioxidant properties. These cofactors participate in many enzymatic reactions in the skin and influence many skin processes to give the other benefits I mentioned earlier. Niacinamide also increases collagen production and fibroblast culture, and this effect may be responsible for the improvement of skin elasticity and reduction of fine line and wrinkles. In a typical product containing niacinamide, you find 2 to 5% of niacinamide. I know manufacturers don't exactly list percentage of ingredients, or else there would be nothing proprietary, but you're sure to see this B3 vitamin down the ingredient list. There are 3 primary forms of vitamin B3 that can be used in topical skincare products: niacinamide, aka nicotinamide, nicotinic acid, and nicotinate esters. Nicotinic acid, even at low doses of less than 1%, can induce an intense skin redness and irritation, or even itchiness. But listen to this. Niacinamide can undergo hydrolysis to nicotinic acid if you mix it with acidic ingredients. So be mindful about adding AHAs or BHAs, say salicylic acid, to your routine while using niacinamide. To be fair, I wasn't able to find literature that could definitively conclude this argument. But I am a safe skincare advocate, and I would be dumb if I didn't warn you about the possible risks. So you want to buy products that contain niacinamide and not the ester or acid version to minimize irritation. Everyone could develop irritation with any ingredient, but this helps to minimize your risks. If you've got a question about its effectiveness against acne, well, I've got a little bit of information for you as well. One study compared niacinamide's anti-inflammatory effect at 4% in the management of acne vulgaris. They found that the effect of 4% niacinamide was as good as 1% clindamycin. In case you didn't know, clindamycin is a first-line topical antibiotic that's prescribed to treat mild to moderate acne. In a comparison against retinoid, niacinamide is roughly 1/3 to 1/5 as effective as topical 0.025% retinoid. There was also one study that compared the combination of niacinamide, peptides, and retinol propionate versus 0.02% retinoid. This clinical study was done for 24 weeks, and the goal was to see improvements in fine lines and wrinkles. Both groups improved the fine lines and wrinkles by the end of the trial, but the niacinamide group was better tolerated and showed more effectiveness as early as 8 weeks. I just want to point out, because niacinamide reversibly blocks the transfer of melanosomes, it means the hyperpigmentation you're prone to will come back if you stop using niacinamide. Most people have this idea that they will permanently change their concerns, when in fact it does take time to see change and diligence to keep it. Okay, that's enough about topical niacinamide. If you'd like to eat foods that contain vitamin B3, turkey, chicken, dairy products, liver, nuts, mushrooms, fish, peas, and even injera are good examples, so eat away. The second most commonly found vitamin B in skincare is vitamin B5 or panthenol. Panthenol is the provitamin, a precursor. That means when panthenol is applied topically, the body will convert it into vitamin B5, also known as pantothenic acid. Panthenol is a humectant that binds to and holds water in the skin and preserves moisture in the skin, which in turn improves skin elasticity and suppleness. Panthenol also has anti-inflammatory properties and is involved in activating the proliferation of cells that are important for wound healing and restoring the function of skin barrier. Panthenol is a great product, particularly if you have dry skin. It works well with other humectants such as hyaluronic acid. There are products in the market I'll share with you in the future. For now, let's continue building some foundation so when I share products, you have the knowledge to hold me accountable. And really, that's my goal, to help you pick products that work and not follow the trend. You know your skin better than anyone, and what you need is a bit of information about the science of the ingredients so you can make informed purchases. Now, moving on, vitamin B6, pyridoxine HCl, which helps to balance sebum and reduce excessive oiliness, but it's more often used in hair products, so never mind. Same with vitamin B7, aka biotin or BH. There are some data vitamin B9 or folic acid used in skincare typically helps with anti-aging, photoaging, and prevents DNA damage, but it's not extensive. The rest of the B complex you gotta take systematically. That's it for today. As always, you'll find literatures I referenced down in the description section, so be sure to check it out if you want more information. Happy holidays!